Good afternoon. Before I move into the updates, I really want to give a heartfelt thank you to all of those who are on the front lines trying to protect people who live in Tulsa and Tulsa County. Tulsa Health Department, we have staff who have worked almost around the clock for a month, have sacrificed everything to do their jobs and be there for you. Healthcare providers have not had a chance to step back and take a breath. First responders are on the front lines. Just want to remind everybody that there's people working around the clock all through the community, city and county, public and private sector, to serve everyone who lives here and to protect everyone who lives here. I want to say today that we reported 14 new cases in Tulsa County, and epidemiological investigation of those cases are currently ongoing. This brings the total to 41 confirmed cases in Tulsa County out of 248 statewide. There have now been a total of 7 deaths in Oklahoma, including the 1 Tulsa County death that had been previously reported. We've gotten a lot of questions about safer at home and what does that really mean. It means that being at home as much as possible lessens your potential for exposure to COVID-19, as well as, more importantly, it lessens your ability to transmit it to others. Does this mean you can't go outside your home? And no, it doesn't. And I want to be very clear. We've had incredible spring days this week. We want everyone to go outside in your yard, play with your family. We encourage you to take your dog on a walk. It's really about being mindful of your surroundings and practicing social distancing of at least 6 feet. We're asking everybody to move, to connect, be mindful, stay apart 6 feet. Most people who become infected with COVID-19 will have mild symptoms and can treat those at home. But for some people, including those who are older or have chronic health conditions, the illness can be severe and even deadly. Symptoms of COVID-19 include fever, cough, and shortness of breath. If you're experiencing these symptoms, stay home and call your healthcare provider. Do not call 911 unless you have a medical emergency. Our first responders need to be able to serve those who have true emergencies. And I really want to emphasize, if you call 911 for any reason and you are concerned you may have been exposed or currently have COVID-19, let the operator know so that the first responders can take appropriate precautions to protect themselves while helping you. Please communicate that information. Our local healthcare systems are continuing to screen and test high-risk priority individuals for COVID-19. These numbers are reported to the Oklahoma State Department of Health daily. The State Public Health Lab is now averaging 24-hour turnaround time on results, which is a great job that they're doing. It should be noted that not all samples are sent to the Public Health Laboratory. Local healthcare systems are also using their commercial and private labs as a resource. Today, we are going to continue our mobile sample collection site at a confidential, unidentified location. Yesterday, the model went very well. The process went very well. This site is for appointment only for pre-screened, high-risk individuals who are under or uninsured. Once again, resources remain extremely limited. At this time, we have enough supplies to collect samples for an extremely limited number of individuals. We have requested more. Of course, everyone has requested more, but testing capabilities are limited by finding reagents and swabbing kits. The specimen collected yesterday that we took were sent to the Oklahoma State Department of Public Health Laboratory. What we can all do right now to try and prevent exposure, and what we can do to limit exposure as well, try to let go what you can't control. Focus on what you can control, like staying home, staying 6 feet away from the public when going out for necessary errands, and washing hands. We won't see the paybacks of our actions today until a few weeks from now. So we need to remain patient and cooperative for this time frame. We need to remain vigilant about staying apart. I know Tulsa County residents are experiencing emotions of loss. We feel the world has changed, and it has, and we need to be very honest about that, and we need to recognize that. The places where people gather are the greatest conduit for transmission. Our children don't understand why they can't go to school, play their sports, or see their friends. We know the emotional state that everyone is currently experiencing. We know this is a tremendous loss for people, but we also know that this state we're in today is temporary. This will not last forever. We need to continue coming together around staying apart. If you have any questions, please communicate. Tulsa Health Department, your healthcare provider, the city and county have information as well. Seek your information from trusted sources, please. I'd like to now introduce Mayor Bynum.
Thank you, Dr. Dart. Just a couple of items for today. First, we've had a number of businesses contact the city of Tulsa asking if you're classified as an essential business, do your employees need to have a sheet of paper or a document testifying to that fact for them to be able to drive around town and go to your business or their place of employment? The answer is no. We're not pulling people over and asking for their documentation to be out in public in a vehicle. And so I know there are some places that have done that, but we are not doing that here in Tulsa. You don't need to have documentation to go to work. Secondly, I've had a number of people ask if they see people violating the orders that have been put forth here in the city or by the state. Who should they call? How do they report that? The best way to report that is to call 918-596-9222 in the city of Tulsa, and that is to report that to the Tulsa Police Department. Again, it's 918-596-9222. The last thing that I want to cover today is that, as Dr. Dart mentioned, we're really trying to do all we can to put in infrastructure, if you will, that allows people to stay apart as much as possible. That's why we've implemented our remote work protocols at the city of Tulsa. That's why the Tulsa Police Department has changed their processes for how they engage with citizens. That's why the Tulsa Fire Department has done the same. All of us are trying to find ways where we can encourage remote work and close down those functions or events that lend themselves to rapid transmission of this virus. One of the things that we've seen folks have a real challenge with in this area is around utilization of our parks. As I mentioned the day before yesterday, we think it's really important that people get out and be outdoors during this event, not be just locked up in your house 24 hours a day for weeks at a time. That can lend itself to other health problems, both for individuals and for families. So we want people to get out. And we're very lucky here in Tulsa that we actually, amongst American cities, are we're one of the best in the country for the number of park acres per capita. So we have a lot of open space for people to utilize. What we've seen is, unfortunately, that people aren't just utilizing open spaces in the trails, but are going and playing on playground equipment, having volleyball games, playing basketball and pickleball. These are all things that draw people together, which are exactly the kinds of events that we're trying to avoid. And so, starting today, we are closing all City of Tulsa playgrounds, all City of Tulsa adult fitness facilities, sports courts, dog parks, and skate parks. We want you to utilize the park system that you, the citizens of Tulsa, pay for at this time, but we have to be smart about it. And getting together and playing on playground equipment when we cannot sanitize it every day is not a smart thing to be doing. Getting in giant groups of people and playing volleyball and basketball is not a smart thing to be doing. And so to facilitate and take any question about what people ought to be doing in the parks out of the question, we are closing our playgrounds and those sports courts effective today. As Dr. Dart mentioned, we hope that people will continue to practice safe social distancing of 6 feet or more and utilize those open spaces and those trails in a safe way. Now, I think the first question is going to be, well, how are we enforcing closures of playgrounds, things like that? You know, we're not going to assign Tulsa police officers to stand next to a playground and make sure you don't put your kids on it. But what I would ask all parents to be aware of is that the city of Tulsa does not have the ability to go out and sanitize every playground and piece of equipment with the frequency that would be needed to keep it safe. And so if you're letting your kid play on that equipment, you are allowing your child to play in an unsafe environment. So we would ask Tulsans to self-regulate when it comes to utilization of playgrounds and courts. And now I'd like to turn it over to County Commissioner Karen Keith.
Hey everyone. As we continue to move through this dynamic situation, I am reminded of all the goodness in people. There are so many stories of individuals and businesses stepping up to help those in need that I can't mention them all. But in particular today, I'd like to thank the Tulsa County Sheriff's Foundation, which is sponsoring a project to pay various local restaurants to cook fresh meals 5 days a week for the next 2 weeks. The meals will be picked up by deputies and taken to Food on the Move for distribution to area residents in need across Tulsa County. 6 local restaurants have agreed to cook meals for the project that kicks off tomorrow. They are Take Two Cafe, Evelyn's Restaurant, Tucci's, Blue Dome Market, Freeway Cafe, and Elmer's Barbecue. So thank you to each of those restaurants and their owners who are stepping up to help those in need. And what they're doing is vitally important for the community. For information on how you can receive these meals, or if you want to help out, just visit foodonthemoveok.com. And thanks to the clarity provided by the governor, our LaFortune Park and South Lakes golf courses remain open, as do the outdoor tennis courts at Case Tennis Center. Additionally, the grills at both golf courses are open every day from 7 a.m. to 8 p.m. for carry-out dining. And we encourage everyone to take a break and get some fresh air and reduce some of the stress we've all been carrying around. And that's with a round of golf, a tennis game, or taking a stroll around any of the abundant trails in Tulsa County. That said, out of an abundance of caution, we have also made the difficult decision to start closing our playgrounds today, per the CDC guidelines, to further limit the larger groups that are still gathering in these areas. And I cannot say it any better than what the mayor did. I also want you to know that River Parks is also going to follow suit with their playground areas. Now, the governor has also requested each county treasurer waive penalties and interest in connection with the extension of ad valorem tax payment, the property deadlines. And the Tulsa County treasurer is on board to waive those penalties and fees on property taxes for the second half payments that are received on or before April 30th. It's a 30-day extension from the original March 31st deadline. And in yet another sign of how the county is shifting its practices to be more digital during this pandemic, Judge LaFortune has temporarily updated procedures for in-custody waivers and pleas for both preliminary hearing dockets to accommodate twice-weekly video hearings. Details of these updates can be found on the Tulsa County website. And our court services continues to assist the courts with court-related conditions of release, but community service work in Tulsa County is on hold at this time. And those are the crews that you see out picking up trash. So please help keep our county beautiful. Don't litter or dump trash on our roads. And one more reminder related to the courts. Evictions and closures are suspended in Oklahoma until at least April 15th. If you receive an eviction or foreclosure notice, don't move out until you are told to do so by a court or a law enforcement official. Additionally, no public utilities will be shut off during this time. You can seek legal assistance by calling 211 or submitting your information at oklegalconnect.org. Lastly, the Board of County Commissioners will hold special meetings tomorrow at 9:30 a.m. to discuss the need to renew the restricted access procedures for the courthouse, which are set to expire on Monday. Given this, and in an effort to continually to social distance for all of us, there will be no regular meeting Monday, March 30th, or the following week. We plan to meet again on Monday, April 13th, unless the need arises for a special emergency meeting before that. In closing, following a phone conversation this morning with downtown businesses, I want to thank the folks like Elliott Nelson for their collaboration to help all the restaurants survive this unprecedented challenge. And a work to our hoteliers who have empty lobbies and rooms. We have not forgotten you or your staff. In closing, I want to mention the Tulsa Area United Way and Tulsa Community Foundation Fund and the Tulsa Restaurant Employee Relief Fund through the Mother Road Market. Log on to their websites and please make a contribution if you can. Mother Road already has applications for 1,200 $1,000 grants, so they can really use your help. Stay safe. If you're using the trails or parks, keep your distance. So many people are simply ignoring the obvious issues. If an area is too crowded, go back home and try another time. We will all get through this, but we all have to do our part. Thank you.
Our first three questions are for Dr. Dart. Sean from the AP wants to know, what does he think that the governor's list of essential businesses is too expansive? And is the state doing enough, in your professional opinion?
You know, I think that's really a question for the governor. We're focused on Tulsa and Tulsa County and what we can control and do to protect our citizens in Tulsa County. We're all part of this response together, and I think we've got to stop asking questions that divide us and start asking questions that help bring us together and focus on being together. We're going to do all we can, and you've seen and you've heard from Mayor Bynum and Commissioner Keith all that's going on in Tulsa County to protect our community here, and that's what we're going to continue to focus on.
Okay. Maureen from Channel 8 wants the health department had its mobile testing sites up yesterday, and we're hearing more and more about more tests being done. When is that going to happen, and how is that going to happen?
So let me say that what we're doing today is part of a larger system response of all the healthcare systems. Each healthcare system has a similar system that we do, in that patients can either call their phone bank who are in their system, or, as I said, our focus is the uninsured. And so people are being tested. Now, for the health department, our focus will continue to be on the uninsured, and basically we're limited by testing supplies. Once we get more testing supplies, we have a plan in place. We have pod sites that we can set up all over the community when we're able to actually do that, and that's going to be decided by when supplies start coming in.
And Emery from Channel 6, what is your expectation for the peak in Tulsa and the number of patients needing hospitalization?
So we're working very closely with the regional medical response system to actually do some forecasting using some predictive analytic models that tell us that. That's important information for the hospitals to know, and hospitals are focused on that. The regional medical response system in cooperation with TAMA is actually looking at alternative care sites if things do ramp up beyond surge and beyond capacity. So lots of planning, lots of predicting and forecasting based on what we're seeing now, which we know that changes on the hour.
There's two more questions that came in for you. The Tulsa World, we're seeing posts circulate on Facebook about how gargling things like warm water and vinegar can wash the virus down into your stomach and kill it. Can you speak to the validity of these ideas?
You know, I don't want to speculate. I just want to focus on what the science is telling us now. We know there's lots of anecdotal information that I mean, if you gargle, that's what happens. You remove potential pathogens that can get into your system. This is really, it's when you're infected, the infection starts through your respiratory system. So going through your throat, not sure how helpful that's going to be, but let's continue to follow the science. Let's follow the recommendation that science tells us to prevent exposure. And as more of that information comes out, of course, that will be shared.
Maureen from Channel 8 says, we've heard some symptomatic people that are concerned they aren't being tested. Explain the qualifying factor that go in determining who gets tested and when.
So because, I mean, I wish at this juncture we could test everyone who possibly thinks they need a test, but because of our limited supplies, we really have to focus on those most at risk. So of course, a known exposure is number one, and then we go through a clinical presentation of fever, 100 degrees, 0.4 or higher, cough, shortness of breath, aches, and which sounds like flu, doesn't it? So that's really why it's important that, because these other respiratory illnesses really present similar symptoms, it's important that they call the healthcare provider, go through a more detailed screening questionnaire at our triage phone site. We have nurses there to answer those questions. So you will be triaged by a medical professional who will give you information where to go if you identify as one of those individuals who do need a test.
Okay. The next two questions are for the mayor. Maureen from Channel 8 says the stimulus package is expected to pass the House tomorrow. Can you elaborate on what this might mean for hospitals, testing facilities in Tulsa?
I mean, we're monitoring that. Everything on the federal level has been so fluid. I'll be completely candid. Most of my focus is on our work on the ground here right now. We do have people on our team at the city who are monitoring the work at the federal level and working with members of our delegation. I do want to say Senator Inhofe, Senator Langford, and Congressman Hearn have all been really fantastic in representing our community on this stuff as we look at this stimulus program and how we might be able to support local first responders. And so I appreciate them reaching out to us and trying to identify what we feel should be in that program. It means a lot to have that kind of representation. But we're monitoring it, and like everybody else, we'll work with whatever we can get.
Rick from Fox 23, the city sent out earlier this week notifications that there is still utility line work and street construction. Are those projects still happening? Is it easier to do those projects since most people are at home and off the street?
Some people ask me that about reduction in traffic. We're actually not seeing a lot of reduction in traffic on the streets, surprisingly. And so it's not like you see some pictures of cities around the country where there's just no one on the streets whatsoever. That's not the case in Tulsa. People are continuing to drive around and take care of work and personal responsibilities. We are continuing with our streets and capital improvements program, though, and we'll continue those projects moving forward.
Let's see, Tulsa World, what does enforcement look like for those who are considering safer at home? What kind of penalties could they face?
So that's something that we're continuing to work through with the state of Oklahoma on what those protocols look like, how the Tulsa Police Department interfaces with state law enforcement on that front. And I was just talking with our legal department about that before I came here. So I don't have a good, clear answer for you right now.
One more question. Is anyone beyond the 3 City of Tulsa employees impacted?
I'm not sure I understand the question.
They just asked if anybody was beyond the 3 City of Tulsa employees.
Okay, I'm going to assume they're talking about the employees that we had put under observation earlier in the week. Yes, I mean, again, we have 4,000 employees in a very outward-facing organization that is out doing its work in the field every day. And so the last number I heard was that we have had about 16 different city employees throughout the course of this event put into quarantine and put under observation. Our Human Resources Department and our city physician have put in a very stringent isolation program in cooperation with the Tulsa Health Department to make sure that we don't have contagion within our workforce at the city. Thank you. Any other questions? Okay, well then. We have no other questions. Thank you all very much.